Lovely to have you on the show. What was your reaction when you heard the Prime Minister talking about his weight and his vulnerability to the harsher symptoms of COVID-19?
Well, I think first and foremost, Mark, I think it's a positive step from the Prime Minister. For a very long time, we've had a big problem with obesity and its related diseases in this country that have not been effectively tackled. And I think, with Boris getting sick from COVID, I think he realized that his weight played a significant role in his illness. And the data does tell us that if you're obese, which he was, then your risk of death from COVID-19 is likely doubled. But I think beyond that, I think the much bigger issue, Mark, is the fact that actually diet-related disease affects many more people, even people who have a normal weight and people who are overweight. And obesity is just the tip of that diet-related disease iceberg. And when it comes to what the roots of the problem is, it's the fact that we have failed to tackle the ultra-processed food environment. More than half of the calories now consumed in the British diet comes from ultra-processed food. And what does that mean? Essentially, industrially produced food that comes in a packet usually has 5 or more ingredients. And what that does is it replaces nutritious food, and also these sorts of foods are designed to be cheap and hyper palatable. And what they do really from a biological perspective is they encourage us to overeat. So in a way, the food industry have been, profiting very handsomely for a very long time, but at the expense of population health. So we really need to, what we should be focusing on more than anything else is reducing our ultra-processed food consumption if we're going to really make inroads, both in terms of improving the levels of obesity and type 2 diabetes and heart disease, but also, improving our resilience to infection. And basically, poor metabolic health, which is related to excess body fat, means poor immune health. So moving forward, hopefully we'll get through this pandemic in the next few months and come out the other side. But who knows when the next one will come along? And if we have our baseline population health as being as dire as it is at the moment, then it's going to be potentially even more devastation next time.
So are there examples globally of nations that are healthier and slimmer who have had less to fear from COVID-19? I mean, if we looked at that high death toll in the UK, and of course every life is a tragedy for that person involved and their family, but our high death toll, a lot of discussion about whether we locked down too late and generally the government's measures. But I wonder how high that death toll is in relation to our poor health.
It's a very good question, Mark. So there was actually one sort of modeling study that tried to ascertain what percentage of deaths would have been prevented if we had healthier lifestyles. And their conclusion was about 50%. And we're close to 44,000 deaths in the UK so far.
Yeah.
So imagine that 20,000 deaths at least could have been prevented if we'd had healthier lifestyles. So that is one study that suggests what kind of effect that would have. And you're right, before I answer your question specifically, if you look at the countries worst affected, so we're talking about the UK, USA, Brazil, and India, these are all countries with very high levels of poor metabolic health. Again, excess body fat in simple terms.
And importantly, you can have bad metabolic health and still look all right and be quite slim.
Yes, very good point, Mark. So, we call this, basically it's abdominal fat that's a big issue. So one simple thing that the listeners and people watching can do is, and do at home, and it doesn't cost anything, is measure your waist circumference, and it should be less than half of your height. If your waist circumference is more than half of your height, which is probably 70 to 80% of adults in this country, Mark, then there's likely a problem that needs to be addressed. And the best way to do that is through diet. And just to finally answer your specific question about countries that seem to do well from COVID, 2 that come to mind are South Korea and Japan. And they tend to have lower levels of type 2 diabetes, lower levels of obesity. And certainly there is a very strong correlation, I'm sure, with the fact that their baseline health was better and why they've got better outcomes from COVID-19.
Hopefully the party is over for type 2 diabetes, because I wonder whether there's a culture within our amazing, wonderful NHS that you serve so dutifully, but a culture in which we as a country have accepted a lifestyle-related illness like type 2 diabetes and a health service that's sort of geared towards managing it rather than saying, no, we shouldn't have type 2 diabetes. And in the 1950s and the 1960s, it was a fraction of the number of people with that disease that have it now.
Yeah, absolutely. And it's not a condition to be taken lightly, Mark. Significantly increases the risk of heart attack, stroke, kidney failure, eye disease, nerve disease. On average, people with type 2 diabetes will live 5 to 15 years less than people who don't have it. And of course, with COVID-19, if your glucose is poorly controlled in particular, then your risk of death could be up to 10 times higher from COVID-19. The good news is that within a few weeks of just cutting out sugar and starchy carbohydrates, people can send their type 2 diabetes into remission. I have many patients that do that. But I think one of the problems, Mark, that we need to talk about, really, the elephant in the room, is that unfortunately public health guidance, public health dietary guidelines have been influenced, corrupted by the food industry. And unfortunately, this is another big issue that needs to be tackled. We have too much corporate influence, if you like, on public health messaging, and that needs to be tackled as well as improving the food environment.
We are being entreated and instructed by NHS Eat Well guidelines that we must eat loads of bread and pasta and fruit juice, and all of those food items absolutely cause your blood glucose to spiral.
Yeah, you couldn't make it up, Mark. If you look at the Public Health England NHS Eat Well guide, there's a so-called plate that's supposed to represent a healthy diet. And you've got ultra-processed foods on there. You've got almost 40% of the plate made up of starchy foods. But when you look at the people that are involved in making up the guideline, almost half of those representatives were, half of those people were representatives of companies like Coca-Cola, Kellogg's, Mars, Pepsi. I mean, it is absolutely shocking. And, I will tell you, Mark, I've had conversations with very senior members of people in Public Health England, somebody I won't name, very senior. I want to ask them, why have you got so much starchy foods and ultra-processed foods on that plate? Their response was, well, Aseem, you've got to understand, the food industry is one of the biggest contributors to the GDP of our economy. That wasn't an answer that you expect from an independent scientist who wants to be, telling people what constitutes a healthy diet. We should start there and then let the food industry, sell the foods according to what the independent science says, not the other way around.
And of course, we've seen an extraordinary hit to our GDP as a result of our poor physical preparedness for this virus. Ultimately, Aseem, COVID-19 is a nasty virus. It's extraordinarily infectious, but all viruses exist to test our health, and we have been found wanting.
Yes, absolutely, Mark. And I think we need to try and spin this in a positive way now. Of course, the social distancing measures, personal hygiene, all these things are important. Of course, there is still a little bit of a debate about how effective masks are. I won't get into that. But I think what we can all do, though, and what we should, the public health messaging, what the government should be talking about first and foremost is improving people's baseline health. And that has to start with improving what we put in our mouths. That is the main focus. Exercise has a role to play, but it's nothing in comparison to what food can do for your health. So that's where we need to be focusing things. And if we do that very quickly, Mark, certainly with policy changes, it's very conceivable that within the space of a few years, we would reverse the obesity epidemic and type 2 diabetes epidemic in this country.
Well, we've seen it with an amazing, inspirational local GP in Dr. David Unwin, who has reversed the diabetes of countless patients. Your brilliant best-selling book, The Piopi Diet. Michael Mosley. We've seen Tom Watson, former Deputy Labour leader, lose 7 stone as a result of removing junk from his diet. And he didn't lose the weight because of the stress of working with Jeremy Corbyn. He just changed what was on his plate. And we are really grateful to you, Aseem, for helping us to focus on what should be on that plate and what shouldn't. Dr. Aseem Malhotra there, highly respected NHS cardiologist, author of The Piopi Diet.